History of Borderline Personality Disorder, BPD, Key Figures in BPD Research. The history of borderline personality disorder, BPD, is deeply intertwined with the contributions of various pioneering figures in the field of psychology and psychiatry. These individuals have shaped how we understand and treat BPD, and their work continues to influence the approaches used to help those affected by the disorder today. In this episode of the Borderline Personality Disorder, BPD, podcast, we'll delve into the lives and work of the key figures whose research and clinical practices have been instrumental in the development of BPD as a diagnosable and treatable condition. 1. Adolf Stern, 1938, the birth of the borderline concept. One of the earliest contributors to the understanding of BPD was Adolf Stern, an Austrian psychiatrist, who, in 1938, coined the term borderline to describe a group of patients whose symptoms seem to fall between neurosis and psychosis. Stern's work was foundational in identifying a category of mental health disorders that did not fit neatly into the prevailing diagnostic systems of the time. These patients exhibited emotional instability, difficulty maintaining self-identity, and interpersonal problems, yet they did not show the severe disconnection from reality seen in psychotic disorders such as schizophrenia. While Stern's use of the term borderline was vague by today's standards, his insights laid the groundwork for the later development of BPD as a distinct clinical category. Stern's recognition of the emotional turmoil and relational instability that define the condition was an early step toward understanding the complexities of BPD. 2. Otto Kernberg, 1960s-1970s, Psychodynamic Understanding of BPD. In the 1960s and 1970s, Otto Kernberg, a prominent psychoanalyst, advanced the understanding of BPD by framing it as a disorder of the self. Kernberg's psychodynamic approach to BPD emphasized the internal conflicts that led to emotional instability, particularly difficulties in integrating opposing aspects of the self and others. Kernberg introduced the concept of splitting, a defense mechanism where individuals with BPD view others as either entirely good or entirely bad, with no middle ground. This concept became central to understanding the emotional fluctuations and relationship instability seen in BPD. Kernberg believed that these patterns were rooted in early childhood trauma, especially in cases of emotional neglect or abuse. His work also highlighted the complexity of BPD, positioning it as a disorder that involved a profound challenge in regulating emotions and forming cohesive self-identity. Kernberg's theories influenced much of the clinical work done with individuals diagnosed with BPD, shaping early treatment practices focused on psychoanalytic methods. 3. John Gunderson, 1970s-1980s, Clinical Definition of BPD. John Gunderson, an American psychiatrist, is widely regarded as one of the leading researchers in BPD, particularly for his contributions to the formalization of the disorder within psychiatric diagnoses. In the 1970s, Gunderson began focusing on patients who exhibited features of BPD, and he was instrumental in developing the diagnostic criteria for the disorder. Gunderson played a crucial role in establishing BPD as a legitimate clinical diagnosis in the DSM-3, 1980, where it was officially listed as borderline personality disorder for the first time. His research contributed to refining the understanding of BPD and its symptoms, emphasizing the core features of instability in relationships, self-image, and emotional regulation. Gunderson's work in understanding the core relational difficulties associated with BPD helped shape clinical practices, particularly in treating patients with these symptoms. One of Gunderson's key contributions was his recognition of the importance of therapeutic alliance in the treatment of BPD. He emphasized that a strong, trusting relationship between the therapist and patient was essential for successful treatment. 4. Marshall Linehan, 1980s present, Dialectical Behavior Therapy, DBT. Perhaps the most revolutionary figure in BPD research and treatment is Marshall Linehan, an American psychologist who developed dialectical behavior therapy, DBT, in the late 1980s. Linehan's work was born out of her frustration with the traditional therapeutic approaches that were often ineffective for individuals with BPD. She recognized that many patients with BPD were resistant to conventional therapy and that their emotional instability required a different treatment approach. DBT is a form of cognitive behavioral therapy, CBT, that integrates elements of mindfulness, acceptance strategies, and emotional regulation techniques. Linehan's therapy specifically targets the core issues of BPD, such as emotional dysregulation, impulsivity, and difficulties in interpersonal relationships. DBT was groundbreaking because it provided individuals with practical tools to manage intense emotions, reduce self-harming behaviors, and improve relationship dynamics. Linehan's personal connection to the disorder, she had been diagnosed with BPD herself, informed her compassionate and effective approach to treatment. DBT has since become the gold standard for treating BPD, and Linehan's work has been instrumental in reshaping how clinicians view and treat individuals with this disorder. 5. Peter Fonagy, 1990s present, Mentalization-Based Treatment, MBT. Peter Fonagy, a British psychologist, is another key figure in the evolution of BPD research. Fonagy developed mentalization-based treatment, MBT, in the 1990s, an approach that focuses on improving an individual's ability to understand their own mental states and the mental states of others. This concept, known as mentalization, is critical for regulating emotions and maintaining stable relationships, both of which are major difficulties for individuals with BPD. Fonagy's research emphasized that people with BPD often struggle to interpret their own and others' emotional responses accurately, which can lead to interpersonal conflicts and intense emotional reactions. MBT helps individuals with BPD develop the ability to mentalize, in other words, to reflect on their thoughts and feelings, and understand the perspectives of others, which in turn improves emotional regulation and interpersonal functioning. Fonagy's work also contributed to a broader biopsychosocial understanding of BPD, integrating attachment theory with cognitive behavioral principles to offer a comprehensive treatment model. His research has provided invaluable insights into the neurobiological underpinnings of BPD, particularly the role of early attachment relationships in shaping emotional regulation patterns. 6. Gerald Kreisman and Hal Strauss, 1989, I Hate You, Don't Leave Me. While not researchers in the academic sense, Gerald Kreisman and Hal Strauss made a significant impact on public understanding of BPD with the publication of their book, I Hate You, Don't Leave Me in 1989. The book presented a more accessible account of BPD, focusing on the experiences of individuals with the disorder and their loved ones. It became one of the first widely read works that brought attention to BPD outside of the clinical world. Kreisman and Strauss' book helped to humanize the disorder, offering a deeper understanding of the emotional turmoil experienced by those with BPD. It played a pivotal role in raising awareness of the disorder, helping to reduce the stigma that surrounded it by focusing on the internal struggles rather than labeling patients as manipulative or attention-seeking. 7. Current contributions and the future of BPD research. In recent years, research into BPD has continued to grow, with new studies focusing on the genetic, neurobiological, and environmental factors that contribute to the disorder. Advances in neuroimaging have allowed researchers to explore how differences in brain function, particularly in areas related to emotional regulation, like the amygdala and prefrontal cortex, may contribute to the symptoms of BPD. Modern-day researchers are also exploring the role of trauma in BPD development, particularly the impact of early childhood adversity such as emotional neglect or abuse. These studies are important for shaping more effective treatments and providing a better understanding of the disorder's complexities. Conclusion. The development of borderline personality disorder as a recognized and treatable condition is the result of decades of work by pioneering figures such as Adolf Stern, Otto Kernberg, John Gunderson, Marshall Linehan, Peter Fonagy, and others. Each of these individuals has contributed to the evolving understanding of BPD, from early psychoanalytic theories to the development of effective therapies like DBT and MBT. As research continues, there is hope that more effective treatments will emerge, and that the stigma surrounding BPD will continue to fade, allowing individuals with the disorder to seek the help they need. Stay tuned as we continue to explore the history, research, and future of borderline personality disorder in upcoming episodes.